Good morning, ladies and gentlemen, and welcome back to my channel. My name is Aisha, aka Nurse Aisha. I am a registered nurse and I'm here to spread awareness on preventative health. That is my focus. Now, we're here today on another vlog and it has finally happened. It's official. And I got the letter to prove it. Yes, I am 40 years old. Yes, I have the letter to prove it. So I got this letter in the mail a couple of days ago. This letter with pink details. This is my appointment, calling me to an appointment for my very first mammograph. Yes, this basically officially means that I'm 40 years old because that's what happens when you turn 40 in Sweden as a woman. Of course, as a woman, you are called to your yearly mammograph. And my appointment was actually a few days, no, it wasn't a few days ago. I was given an appointment later, but I called them yesterday and changed my appointment because as a nurse, I cannot, go any other day or any day of the week. I have to make sure that I go on my day off. And I'm off today, it's my day off. So I called them and rebooked my appointment. So it's today at 11:50 and you're gonna come with me to my very first mammograph. Now, before we do that, before we head, I do have a few like an hour before I have to go. So I thought we would talk about this. Let's talk about what it means to go. I'm so happy that I'm basically leading by example because, not a lot of people, well, not everyone gets an opportunity to be called and given an appointment for this very, very crucial screenings. And as my channel focuses on preventative health, why not lead by example and actually go for my appointment when you are with me? Of course, you're not coming in the actual room with me, but we're gonna talk around it and we're gonna go to the actual appointment around the building and I'll show you, well, there's not any preparation for that appointment really, except maybe mental preparation and maybe physical appearance, like what you're wearing, what type of bra you're wearing that day, I guess, because really I haven't got prepared. But let's go through the details of going to a mammograph, your first mammograph appointment. All right. So before we get any further into this video, I want to remind you to subscribe, like, and comment on this video. Make sure that you subscribe to our channel and we can grow as a community and I get the opportunity to make more of these videos for you. All right, so my first mammograph. It's actually not my very, very first, but it's my first as a 40-year-old woman. I got a mammograph in my 20s, I believe. Yes, I had, being that I check my breasts regularly, like you should, I remember in my 20s, somewhere in my 20s, I checked my breasts and I found a lump. It was not very big, and I remember it wasn't something that hurts, which, if it hurts, it could be something else, which is maybe better, I guess. That's what they usually say. If it hurts, it could be an abscess, not really, like an infection. But I remember this being there for a while, and I just felt like it wasn't the normal lumps. If you felt your breast as a woman, depending on your size as well, I'm a big kind of in the big chested, people. But I knew that these were not the normal lumps or the normal breast tissue that I was feeling. It was just not, it was hard and it was separate from the normal breast tissue that I usually feel when I feel my breasts for the monthly checkups that you have to do yourself. If you don't know what that means, I have a few videos on that. I have a few, let's say, tutorial on that on my channel. So yeah, so I felt that lump and I actually went and checked it up. And I remember I had a biopsy as well done. And after, before the biopsy, I had a mammograph, and it was very, very uncomfortable. I remember because I was younger, and it just, first of all, emotionally, it was very, very draining. And also just physically, the way that it's done, it felt, it didn't hurt, but it was uncomfortable. And I remember, because of the emotional, the emotional trip, the whole thing of, feeling a lump and calling my GP, I believe I called my GP first, and then they booked me, they gave me a referral to the breast clinic. And in your 20s, that's not really something that you want to go through, I guess. So it was very, very unnerving, and I was very uncomfortable, and there was a lot of tears. But now in my 40s, and also being a registered nurse for a while, I know how important these screenings are, and I'm going in with nothing that in my knowledge. I know that there are some benign lumps still there. I believe that one is still there because it was never taken away, but I think it's shrunk during the years. I'm going in to this mammograph. I'm not quite sure how I feel about it, actually. I wouldn't say excitement, but I'm not scared. I am prepared. I expected it also because, this is part of the screenings that we do here for women, especially breast cancer screenings. And this does not only happen during October month. This should happen throughout the year because, diseases don't stop because it's not, October month. It's not the days that we recognize these diseases. So I've been called now in May to go for my first screening. And I guess I'm really, really blessed. I feel how do I feel? I feel privileged that I can actually do this. I know a lot of you do not get this type of treatment. You don't get this type of that is part of your health program in your countries. You actually have to go by yourself and book these appointments and pay a lot of money. This actually costs the normal cost, which is also regulated by the government of Sweden, and it's also part of a screening program to prevent breast cancer with women. So I'm gonna read to you what it actually says and why we have to go for these screenings, because they actually describe why you have to come, and the why, how, and when. So this has been booked by Region Stockholm, where I live, and they chose a clinic closer to my house. And basically the only thing that you have to bring with you is your ID. So breast clinic, So why do you have to come? This is all in Swedish, so I have to translate. This is why you've been called or booked for a mammograph. According to Socialstyrelsen, every woman is recommended to be called for an appointment, especially women between age 40 and 74, for a regular mammograph. It's a radiology screening of your breast, and a mammograph is done to detect early changes that can lead to breast cancer. That is why you have to go. Everyone that lives in Sweden, every woman that lives in Sweden has to go for these appointments between the age of 40 and 74. Of course, something happens in between there. Like I said, I had a mammograph in my 20s. You can go earlier. So then they continue to write, every screening is important for your health. They go on to say that breast cancer is the most common type of cancer in women in Sweden, and all breast cancer types you cannot feel it, basically. Around 2/3 of breast cancer detected within the age group that we talked about, 40 to 74, are found through screenings with doing the mammograph. So it's therefore very important that you actually go for your mammograph. The actual screening is, it's not mandatory, so they cannot force you to go to these screenings, but it's recommended. All right? And you basically are called, it's recommended every time that you have been given an appointment. If they find any breast cancer tissue, the chances are higher that you can be cured, right? So this is why you have to go for these appointments, ladies. Because early detection is key. And we talk about this. I talk about this all the time. You should go for these appointments, even if they're not mandatory. And just like I did, if they give you an appointment when you're not free, you can call them. The number is on the actual appointment that you got in your mail. So call them and book for a day that you're off. There's really no excuse to not go to these appointments. And then they go on to explain how the actual screening is done. First of all, you're going to answer a few questions, and then you're gonna remove your clothes on your upper body, and then a radiology nurse is going to look through. So basically, they actually feel your breasts for you during this appointment. That's what the nurse does first. And after that is done, then your breasts are screened with the actual radiology mammograph machine. The mammograph actually takes 5 minutes. That's only 5 minutes of your life. It's not dangerous, okay? So a total of 30 minutes altogether, with answering the questions, the radiology nurse going through and palpating your breasts, and then the actual radiology screening. That is also included in the waiting time. Then you get your results will be sent to you after they're analyzed by the radiologists, basically. And the actual it will come in the mail just like this did. So this is really good information. The only thing is that I'm thinking about while reading this is that unfortunately not everybody can read this information. Okay, so that's the reality of us, especially African women and women of color or people from other countries, anyone that doesn't speak the Swedish language, because this is completely in Swedish. There's no English version, which could have been very easy to get. It's tough. It's tough when you live in the diaspora and you don't speak the language of your host country or the country that you live in. when it comes to preventative health and these types of screenings, these are really important to talk about, and just like they did, explain why you have to go. And like I said, we shouldn't only do this in October. We should remind people all the time how important these screenings are. So what we're going to do is that you are going to accompany me as I walk into the office and go to my very first mammograph. And like I said, it's official. I'm a 40-year-old woman, and it's amazing, really. It's nothing that scares me, because just like my hero and my very own beloved Prince, the artist formerly known as, may he rest in peace, said, what's the use of being young if you're not gonna get old? I feel like older woman, I guess, and I have a lot of knowledge, I guess, to accompany that, because you know, it is what it is. I cannot change time. I cannot turn back the time, and so I'm enjoying it, and I'm doing what I'm supposed to do as a woman in her 40s. And what I want to ask of you is to let me know if you have done your mammograph. Have you booked your appointment? Have you got an appointment? Have you been offered an appointment in your country? Please let me know in the description box. And if you have to pay for this, let me know how much you're paying and how often that you are going for your mammograph. I'm sure that here we are called either every year or every other year, and maybe for some people every third year. And remember that women that are at risk, especially women that have mothers or grandmothers that have had the disease, like breast cancer, are called more often and take more tests. Usually when they talk about the hereditary of breast cancer, we talk about the females in our families that have had the disease. So when you're going for these appointments, I think, well, for those of you that have daughters, take your daughters with you. And if they cannot come, talk to them about this, so that it's a normal discussion that you can have, that we have with our daughters. Talk to them and explain why we do this. Because then when it's their turn, because it's going to be their turn at some point to check their breasts, and especially if they're daughters that have already started their periods. And it's important that we talk about this, because I don't see the reason to not talk about our bodies to our daughters and explain, you know, what they might experience. Now, we're not going to go into the details of when you actually get diagnosed with the disease, because it's tough. I mean, your doctors will explain if that is the case. But it's important that you acknowledge it and accept it for what it is. From my experience, I have been fortunate enough to see and care for patients with breast cancer. Very early on in my career, and also just last summer, I worked at a breast and endocrine unit. And I have to say, there's something about breast cancer patients that is, what's the word I'm looking for? They are warriors. They're she-heroes. They are so strong. You know, there's this aura around them, you know, because, you know, someone goes in with for a mastectomy, if that's, or a partial mastectomy, and the mastectomy is when they remove the whole breast, and the partial is when they remove breast tissue, part of the breast. But I always find these women so strong. Oh my God, I'm getting teary. Because they're the strongest cancer patients that I have scene. Oh my God. I'm bawling. Okay, so yeah, because one of them I met last summer, and actually around this time last summer, and she has passed on, of course, unfortunately. Oh, sorry. So this, I guess maybe because the disease is well documented, and we have talked about it on the breast cancer galas, and we've talked about it. We've seen it play out on Hollywood movies and all of that. You know, the shaving of the hair, and you know the wigs. Talking about the wigs. Remember Samantha in Sex and the City. That was a part of the series when it was on air. So I guess, you know, it's they have a flag, you know, that is held for them, and they should. My patient last year was so strong. She was actually educating the rest of her family about the disease. I don't think that her family, unfortunately, she left her mother and father. But she was telling them, you know, that it's okay. I'm going. This is my time. My time is out, basically. Because when I met her for the first time, I remember she asked her mother to go home, because her mother was staying in the room with her, and she felt suffocated. She just wanted time for herself and her thoughts. She had kids, she had a husband, and the way she explained it to me, she said, you know, she had everything planned out. She had decided, you know, that when she passes on, her husband can remarry, and the kids were very, very young. I guess this is why I'm just thinking of her. I can't even imagine the pain that she must have gone through. Yeah, I think her youngest was 6 years old, and they had an agreement with the 6-year-old, you know, for the time after that she has passed on. And she told me everything, and I just told her to stop, because I was in my scrubs, I was on duty, and I was crying because she was so strong. She was so strong. Yeah. Anyways, I'm not gonna talk about, you know, the worst case scenarios, but I know the importance of going for these screenings. I know the importance of early detection. So, and this is why I'm here, you know, for the awareness. It's very important that we spread awareness on these diseases, on these preventative health methods, so that we can save lives, and we can save maybe our own lives or somebody else's. And most of the time, I mean, breast cancer is not always a terminal disease. You know, you can get cured with radiology, with operation, with different types of treatments. Sorry. Yeah, so, and this is why it's important for early screening and early detection. So as I wait for my train, I forgot to tell you that I turned 40 last month, April, and it's a little bit over a month, and I already have this appointment. So it's very well regulated. Now, everybody born 1984, you will expect this letter in your mail telling you to come for this screening, and make sure that you go for these screenings, because people, it's preventative health, and prevention is better than cure. It benefits you to go for these appointments. There's no reason why you shouldn't go. Like we always talk about, invest in your own health. All right, so I've got off the train, and I think I miscalculated a little bit of how far it is from the train to the actual place. That's okay. The weather is amazing, 20 degrees Celsius. I'm not really dressed for the weather. In fact, I'm dressed for colder weather. So I'm in a bit of a hurry, I guess. But I'll make it. When the sun is out, everyone is all smiles. Cherry blossoms everywhere. It's just amazing. The sun can do so much. Also for my skin. Alright, let's see. Should be here somewhere. So ladies, this is how an actual mammogram machine looks like, and you get screened or take pictures from the front and from both sides of your breasts. The radiology nurse assists you all throughout the process. Also, this screening is completely free of charge for all women here in Sweden. So I'm done. I am done. Little discomfort in my boobies, but I'm fine. So I received a lot of information about this screening that I'm going to share with you as soon as I find a place to sit and talk. The radiology nurse was really nice to give me the information that I needed, especially for people from with other cultures, and people that don't speak the language, what they should do when they receive these appointments. We talked a little nurse to nurse conversations, because we need to look out for people that have not gotten into the culture, integrated basically in the culture where they live, in the countries that they live. Maybe it be Sweden, maybe it be Germany, Netherlands, UK. UK maybe is easier because of the language, English. Most people can learn English, but not everyone can learn Swedish and German and all other languages. Therefore, and also we have to think about that people can be illiterate. That is also a problem. So let me sit down and I'll share the information with you. I'm actually going to go to my next appointment, which is with my therapist. So around her area I can sit and share the information that I have with the nurse, the radiology nurse. All right, so I just finished my mammograph, and it wasn't that bad. My breasts are a bit, what's the word? They're just a bit numbed, or like, they hurt a little bit. I wouldn't say hurt, but just a bit of, let's say I can feel my breast at this point. So I talked, like I said, I talked to the radiology nurse about the the actual screening and the importance of the screening. And I told her that I have some feedback about the actual appointment letter that I got, that the fact that it's only in Swedish. I explained to her that I'm doing this vlog for the purpose of preventative health and getting mammograph screenings, and she said that is really important because some people don't show up. So we talked about what they do, about the fact that they don't give out the appointment letter in any other language, and she said that they do campaigns during different exhibits during the summer, and one of them was Järvaveckan. If any of you live in Sweden know Järvaveckan, in Stockholm specifically, you know that Järvaveckan is very big. It's an exhibition, it's actually a political exhibition, but health is politics. Unfortunately, that's what it is. It's the truth. So they have a tent and give information about breast cancer screenings. And also she said that it's everybody's own responsibility to actually make sure that when they get this letter, they ask someone, even if it's a neighbor, to translate, and if or a child. And she said that when they're at these exhibitions, there's also another one, especially in the areas that are considered to be what's the word I'm looking for, you know, areas with a lot of people from other cultures that might not have access. Well, they have access because she said as soon as you have a social security number here and you are documented as a person living in Sweden and you have a personal number, that's our social security number, you get this appointment letter, and it's your responsibility to show up to this appointment. And they're all over the country and all over the city, the breast clinics, so they have appointments. So the own responsibility, which goes back to prioritizing your own health. So we talked about that, and she said during this exhibition they've had men and younger boys come to them and take these leaflets, which I forgot to pick up because the one that I showed earlier, Get to Know Your Breasts, and many of them take them to their mothers and their sisters, and they give them the information, which is really good. It's really good that men are proactive about women's health. If you don't have anyone to read the appointment letter for you, you can go to other entities like Medborgarkontoret. There's a center for people that have trouble with the language that can read for you this information, if it's from the migration board, if it's from the breast clinic, if it's from the tax office, if it's from a hospital, it's anywhere. This Medborgarkontoret, this center, can help you read this information and translate it, and so that you can show up to your appointments. So that's what we talked about. And then the most important thing that she said, that some women miss these appointments saying that they have breast implants, thinking that if you have breast implants you cannot do a mammograph. That is not accurate. She said they're very, very used to breast implants because a lot of women have them, and they can actually take pictures around the implantation. If you're that type of woman that has breast implants, because you know it's an operation that a lot of women do, they can take pictures around it, and you don't have to worry about the pressure bursting your implant. It cannot do that. As long as she has worked, it has not happened, and they're very professional about it, and they know how to do it with women that have breast implants. And also she talked about people that don't have enough breast tissue. So she really educated me during this session. She said you can always get some type of tissue and get pictures that you need. So you don't have to worry about that your breasts are too small for the screening. You don't have to worry about that either. So breast implant, smaller breasts, that is fine. Just show up for the appointment and we can fix it somehow. What was the last thing that we talked about? Yeah, she talked about if you're still on your period, because you know this appointment is for women between 40 and 74, so around maybe your 50s, you're no longer having your periods if you're going into menopause. But as long as you have your periods, you should feel your breast and get to know your breasts 2-3 days after your period. We talked about that. You don't have to worry about integrity, as though you feel as though someone is touching your breast. It's not even about that. It's not invasive in that way, and they do it very professionally. They're very, very professional people. There's no reason for you not to go for your mammograph and your breast screening appointment. So please make sure that you do that. And before I forget, and as I'm ending this vlog, I urge you to prioritize your health, which I'm about to do with my mental health, and go for my appointment to my therapist. But I combine that with my breast screening. Amazing that you can do that I can do that. Yeah, so those are the things that I wanted to talk about on today's vlog. Please don't forget to subscribe, like, and comment, and share these videos to your family, to the women in your life, your mother, your grandmother, your sister, whoever needs to get this information. All right, so thank you so much for watching, and I'll see you in my next vlog or video.